reflected on and collated our experiences from our duty at D.Santiago Health Center, and upon our final evaluation, we agreed that the health center was in need of a better system for its record storage in order to make records retrieval more swift, easier, and less time-consuming. First of all, what is the system? So, electronic patient records acts as digital storage for all the health center's clients' health information to provide a more efficient way of retrieving and keeping pertinent data. The proposed system will utilize cloud storage and directories to effectively categorize the records in a straightforward manner. For this system to work completely, the need for electronics, either desktops, laptops, or tablets, in every station is inevitable. There should be at least 2 desktops at the admissions table and 1 device for each of the physicians' and dentists' rooms. This is to facilitate better transfer of data from the admission nurses to the physicians for when they are already with the patient. In regards to this, records should be created directly into their corresponding folders to avoid displacement of patient private data. So what are the goals and the possible benefits of the system? Number 1 is enabling patients and healthcare workers to access accurate, thorough, and recent data at the point of service and care. Second is improving patient data protection and confidentiality. Third is making patient records readily available in just one click to facilitate a more coordinated and effective care. Number 4, assisting the health center and healthcare workers in enhancing efficiency and establishing a work-life equilibrium. And lastly, minimizing expenses by reducing hard copies of the documents like envelopes and bond papers, as well as duplication of the files, enhancing the safety of documents, and improving healthcare in general.
The initial step for implementing and utilizing this system would be first, arranging all the documents by barangay and family numbers in order. Second is transferring all the patient records into digital folders and documents. And under that, the healthcare workers will allot at least 1 hour every after work for arranging and transferring the original hard copies of the document to the electronic health records, or the system. And then third, after transferring all the documents on the digital platform, the devices available in the health center, like the laptops, computers, iPads, or tablets, will be connected to the central computer containing the EHR or the system. And lastly, the connected devices will facilitate the easy access to the data for improved healthcare service. So upon admission, you give a queue number to the patient upon signing the logbook or upon entering the health center. And then once the vital signs are taken, they would be called to admissions. In the admissions, you ask the patient for their barangay number and family number. So in cases where the patient forgets their family number, you ask for their surname. And if their surname cannot be found, you ask for the surname of their family member with a record in the health center and make a file under it. And if both do not work, you create a new file with a new barangay and family number under their barangay. And after that, you open their corresponding folders and you create a new file for the patient's new admission. So, for old patients with the records, you open the folder and create a new file inside. For old patients without records, you create a new folder and new file. For new patients with records of other family members, you open the family folder and create a new file under it. And for new patients without records, you create a new file and new folder. And after that, you start admitting the patient and ask for their chief complaint. Once done, you send the queue number and the surname of the patient to the doctor available or the dentist to add to the line. And the patient will go back to the waiting area. So the doctor will start calling for their queue numbers and the patient will enter the doctor or dentist's room. So the doctor or dentist will search the patient's surname or barangay and family number and open the file that was made upon admission. And then, findings and prescriptions ordered for the patient will be made available in the system. After consultation, The patient can proceed to the pharmacy if there is any drug available. So the person in charge of the pharmacy will receive the electronic prescription order from the doctor or dentist through their devices and check if the health center has any available medicine. For effectively closing the chart, the system will have history, or the latest files added to the system will be accessible. So the nurse can access the newly added charts and close them by continuing the implementation and evaluation phase of the care. And the service ends here. Because everything is digital, they do not need to rearrange the documents and put them in their corresponding barangay numbers. Everything will be accessible with just one click.